What is orofacial myology and orofacial myologists? Orofacial myologists or myofunctional therapists treat what are known as orofacial myofunctional disorders, or OMDs for short. Orofacial myofunctional disorders are compensations we have adopted due to some kind of disruption within the development of the face, airway, and eruption of the teeth. These can include thumb and finger sucking habits, a habit of resting with the lips apart, mouth breathing due to enlarged tonsils and adenoids or other problems in the airway, the tongue resting forward and low between or against the teeth, tongue thrust, or other harmful oral habits. Many people don't realize that one of the most important things you can do for your child beginning at birth is to make sure that they are breathing through the nose during the day and night. Orofacial myofunctional disorders are often related to or can contribute to low resting tongue posture or tongue thrust, disruptions in eruption and development of the teeth, problems with speech and language development, especially speech articulation, feeding problems or picky eating, gagging and choking, abnormal facial growth and development, including long, narrow faces, improper development of the sinuses, nasal passages, and the airway, orthodontic relapse, ear infections, poor sleeping, snoring, open mouth breathing, and sleep apnea, which is a lack of oxygen to the brain. Did you know that the tongue and how we breathe can impact all of the areas that I just mentioned? Here are some examples of myofunctional disorders. From our experience, many people may have heard of the term tongue thrust, which is a myofunctional disorder, but maybe they don't know what it means. Tongue thrust is where the tongue rests against or between the front or side teeth rather than on the palate, which is the roof of the mouth. The name tongue thrust is an action people make when they have this condition as the tongue moves forward to swallow or thrusts forward. The misconception is that this thrusting tongue movement is responsible for moving the teeth out of alignment. However, that's not true. The tongue resting on the teeth or floor of the mouth is one of the major causes of problems in tooth eruption, tooth alignment, and facial development, in addition to problems with chewing, swallowing, digestion, jaw pain, and headaches. Most of the damage from the tongue resting low or on the teeth happens at night, when the tongue presses against the teeth for long periods of time. The tongue, like controlled forces of braces, can move the teeth, and it's a very powerful muscle. Many professionals do not understand how much the tongue impacts the teeth, nor that it maintains the upper dental arch. Because of this, applying braces will straighten the teeth while they are on, but as soon as they're removed, the tongue may push the teeth back out of alignment, especially if retainers are not worn. This is because the underlying problem of the low tongue resting posture was not corrected. For many, it is also a symptom of an airway problem. So crooked teeth are a symptom of a much larger problem.